A Halifax doctor is calling for more safer opioid access in Nova Scotia because he says the drug supply here is becoming increasingly contaminated with powerful tranquilizers. He works with the Mobile Outreach Street Health Unit out of the North End Community Health Centre, which helps homeless people, cope with life on the streets. Dr. Mike Gniewek, thanks for your time today.
Oh, thanks for having me.
I want to talk to you about opioid use in this city. I know the scene is changing pretty rapidly. What are you seeing? What's the most up-to-date note that you can make on what we're seeing here in the city?
So what we're seeing in our city is an increase in the amount of opioid drug supply that's cut with dangerous additives. We're seeing fentanyl as one dominant thing that's adding to our opioid supply, but also other sedatives, tranquilizers, and medications that were meant for large animals to sedate them being added to opioids, and the combination of those gives the user a really unpredictable and dangerous outcome.
This is the tranq that people are referring to. Was widely thought to be or is a big problem in Western Canada, of course, and in the States as well. But you are seeing it here in alarming numbers in the city?
Yeah. So there's lots of different terms for them. There's lots of different tranquilizers and so fentanyl, carfentanil, other fentanyl analogs, benzodiazepines like Xanax. There's a tranquilizer called xylazine that's being added to medications. All of these produce a sedative effect, lower your respiratory drive, and can lead to overdose.
And in terms of potency, how much more strong are they, or damaging could they be?
Yeah, so fentanyl is 100 times more potent than morphine or hydromorphone. Carfentanil is 100 times more potent than fentanyl, and the other sedatives aren't so much more potent. They're additive, and so they affect people kind of in combination, which makes it even more dangerous.
Do you think that people are aware of that these drugs are being laced, or is there an ignorance factor there as well, that maybe they're getting something they're not even sure they're getting, and therefore they can't be careful about how they're using?
I think it's both. I think regular and everyday users are aware that the illicit drug market is very dangerous, and they try at all costs to avoid it, but sometimes there's no other option, and people are forced to buy something that is unknown and potentially dangerous. But there's also lots of recreational users, people that use substances once a week or once a month, and they think they've got a source that's safe because it's been safe in the past, but now suddenly it may not be. And so often these deaths are from people that use once in a while, and sadly, it's particularly dangerous in those cases as well.
Are you able to help them at all with safe supply?
Yeah, there's lots of ways to help people who use opioids. So there's very robust and treatment options, and for people who haven't been successful with treatment, and for people who don't want to enter traditional treatments, we do sometimes prescribe a pharmaceutical safe opioid supply, essentially allowing people to have a known dose and a known quality of product that they can use, similarly to the standard that we would expect with food or with alcohol. If you come home after work and have a beer, you know that it's 5% beer and it's 375 milliliters. It's not 100 beer or one beer. You know what it is. And so that's, for people who are at high risk of overdose and at high risk of accessing a dangerous market, we do prescribe pharmaceutical grade opioids for them.
But I gather there's not a lot of doctors available to do that. What would you say about that medical side of things?
Yeah, I mean, it is in Nova Scotia and in the Maritimes, there are very few of us that are providing this care. It does require some expert knowledge. It requires support. It requires a network of harm reduction workers, nursing, support staff to provide not just the prescription, but also comprehensive care, help with housing, help with other medical needs, mental health. And so that's one of the things that we incorporate into the prescriptions that we provide.
How receptive are people to your advice, to your help?
Like patients?
Yeah.
So receptive. We've had some incredible outcomes from people who have engaged with us. We haven't had anybody have an overdose death in the whole program since we've launched. People have found stable housing. People have found employment. The quality of life of people that we're providing care for have risen, and generally they're healthier.
So when we see these tent populations popping up in different parts of the city, what's the best approach to to, if legislators and politicians agree with the safe supply approach, what's the best way to deliver that?
I think delivering it as part of a collaborative, comprehensive team that gives people access to safe housing, that gives people access to medical treatment, gives people access to social work needs and income supports, and additionally provides a safe opioid or a safe substance that they're using that they haven't been successful with treatment on. So it's definitely multi-pronged and kind of collaborative, but that's what I would suggest.
We started by talking about how the drug scene is changing in Halifax and indeed Nova Scotia. Is it time to start thinking a little more differently about the way we manage that situation?
Yeah, I think as we see, as we see the market shift, as we see more overdose and more overdose deaths, we have to react. We can wait for the death numbers to rise, but at that point we've lost a number of lives. In Canada, we've seen, tens of thousands of people die during this opioid crisis. And we have an opportunity in Nova Scotia and in the Maritimes to maybe get a little bit ahead of it. Because it would be tragic to respond a year from now when, unfortunately, the deaths have already occurred.
And we'll leave it on that point. Thank you for your time.
No, my pleasure.